Hello everyone, in this video we will be reviewing the frequently asked questions about the musculoskeletal system. Second part of the video we will be reviewing the skeletal system. Musculoskeletal system part 2 skeletal system. Question number 1. Which of the following is not a part of axial skeleton? A. Sternum, B. Vertebral column, C. Scapula, D. Skull. Think the answer. The correct answer is C. Scapula. When you take the axial skeleton forms the central axis of the body and includes the skull, vertebral column, that is spine, and the thoracic cage, that is ribs and the sternum. The scapula, that is shoulder blade, is a part of appendicular skeleton. You can see the scapula in blue colored one. Only this yellow colored one was the axial skeleton. So the scapula, that is shoulder blade, is the part of the appendicular skeleton, which includes the limbs and the girdles that attach them to the axial skeleton. Question number 2. The elastic band of tissue that connects bone to bone. A. Tendon, B. Muscle, C. Ligaments, D. Joints. This question is most frequently repeated, so think the answer. The correct answer is C. Ligaments. You can see in the picture, the two bones are connected with the ligament. The ligaments are the strong elastic bands of connective tissue that connect the bones to other bones, providing stability to the joints. But when you see the tendons, it attaches the muscle to the bone. Question number 3. Which of the following is flexible connective tissue that is attached to bones and the joints? A. Adipose, B. Cartilage, C. Epithelial, D. Muscle. Pause the video and think the answer. The correct answer is B. Cartilage. You can see here, the cartilage is a flexible connective tissue found in various parts of the body, including the ends of bones and at joints, where it reduces the friction and acts as a shock absorber. You can see here in the picture. Question number 4. Which of the following best describes an acetabulum? A flat bony compartment of the shoulder joint, B. A bone in the middle ear, C. The hip joint, D. The base of the spine. Please pause the video and think the answer. The correct answer is acetabulum is in the hip joint. You can see here, this is the acetabulum. The acetabulum is a cup-shaped socket on the lateral aspect of the pelvis formed by the fissure of three joints, ilium, ischium, and pubis. It articulates with the head of the femur to form the hip joint. Question number 5. Phalanges are referred to as A. Artery, B. Cartilage, C. Bone, D. Joint. Pause the video and think the answer. The correct answer is bone. You can see phalanges are the bones that make up the fingers of the hand and the toes of the foot. You can see the fingers of the hand here. This is the phalanges, and the toes of the foot are phalanges. You can see here. Question number 6. The physician directs the medical assistant to complete a request form for an X-ray study of the fibula. The procedure will be performed on which of the following structures? A. Heel, B. Lower leg, C. Toes, D. Thigh. Think the answer. The correct answer is fibula is in the lower leg. You can see in the lower leg, the fibula, it is situated here. When you see close up, you can see the medial part is tibia and lateral part is fibula. Fibula is one of the two bones in the lower leg running parallel to the tibia. Question number 7. Which bone is located in the lower extremity? A. Ulna, B. Femur, C. Humerus, D. Radius. This is also similar to previous question. The correct answer is femur. You can see the femur is the long bone of the body. The femur is the thigh bone, which is indeed superior above the patella, that is kneecap, and inferior to the ischium. Question number 8. Name the shaft of a long bone. A. Diaphysis, B. Metaphysis, C. Periosteum, D. Epiphysis. Pause the video and think the answer. If you don't know the answer, you can take your ICT 10 cm book, go to anatomical illustrations. There you can find the answer. The correct answer is A. Diaphysis. You can see the parts of the bone here. The diaphysis is the middle part, that is called shaft. It is the main and central part of the bone, also known as the shaft. If you take the metaphysis, you can see the both end, you can see the metaphysis. The metaphysis is the wider portion of the long bone adjacent to the epiphyseal plate, that is growth plate. When you see the epiphysis, you can see in the bone's end of the bone. The epiphysis is the end part of the long bones, initially separated from the main bone by cartilage, but later fused with it through ossification. Question number 9. What does the term epiphysis refer to? A. The short end of the bone. B. Enlarged wide end of a long bone. C. The top of a flat bone. D. The edges of an irregular bone. So as we seen in the previous question, the epiphysis is the enlarged wide end of the long bone. You can see both end of the enlarged part of the bone is epiphysis. Question number 10. A patient presents with a fractured tibia. Where is the bone located? A. Upper arm. B. Forearm. C. Thigh. D. Lower leg. The correct answer is lower leg. You can see the tibia present in the lower leg. It's the larger and stronger of the two bones in the lower leg, commonly referred as the shin bone. Question number 11. During a procedure, the surgeon repairs a tear in the rotator cuff. Which part of the body is involved? A. Knee. B. Shoulder. C. Hip. D. Elbow. Pause the video and think the answer. The correct answer is B. Shoulder. You can see the rotator cuff is a group of 4 muscles and they are tendons that surround the shoulder joint. It provides stability and allowing for wide range of movement. You can see most commonly the rotator cuff tear occur in the supraspinatus tendon. Question number 12. Which of the following bones exist bilaterally? A. Sacrum. B. Scapula. C. Sternum. D. Coccyx. The correct answer is B. Scapula. The bilaterally mean the both side of the body. You can see the sacrum here. It's a single bone at the base of the spine formed by the fusion of 5 vertebrae. Scapula you can see here. There are 2 scapulae, one on each side of the upper back. It is called the shoulder blades. Sternum you can see here. It's a single bone in the center of the chest. It also named as the breastbone. Coccyx you can see here. Number 17 here. A single bone at the very end of the spine. It is called tailbone. Question number 13. What bones make up the axial skeleton? So there are 4 answers. Please pause the video, find the answer. The correct answer is skull, rib cage and spine. You can see the bones marked in yellow colors are the axial skeleton bones. They form the central axis and consist of skull, the vertebral column here, that is called spine, and the thoracic cage that includes the ribs and the sternum. The correct answer is A. Skull, rib cage and spine. Question number 14. A patient with an injured neck sustained an injury to which of the following areas of the spine? A. Cervical. B. Lumbar. C. Coccygeal. D. Thoracic. So it's an easy question. So the correct answer is cervical. When you take the spinal cord, you can see the cervical vertebrae here in the neck area, that is C1 to C7. And the thoracic vertebrae in the thoracic and the abdominal region, that is T1 to T12, and the lumbar vertebrae L1 to L5, and the sacrum and coccyx, that is sacrum is S1 to S5, and the coccyx is the single bone. Question number 15. A patient is injured in a motocross accident and has shattered 2 of his vertebrae. Now he is paralyzed from the chest down and can move his arms but not his legs. At what level is his injury? A. Cervical. B. Lumbar. C. Thoracic. D. Sacral. So please pause the video and think the answer. So in this case, you have to note that the paralyzed from the chest down and can move his arm but not his legs. So the correct answer is C. Thoracic. So if the injury at the level of cervical, that is cervical vertebra, it is often result in a paralysis of all 4 limbs, that is quadriplegia. So the upper limb and lower limb cannot move. But in this case, the patient can move the arms but not the legs. If it is a thoracic injury, you can see here, it's often result in a paralysis from the chest down. That is called paraplegia. Here, the upper limbs work normal, but the lower limbs are affected. When the injury is in the lumbar and sacral region, it would typically cause paralysis or weakness of primarily in the legs and lower body. Question number 16. Which of the following bones form the medial malleolus? A. Fibula. B. Tibia. C. Talus. D. Calcaneus. Pause the video and think the answer. The correct answer is B. Tibia. You can see in the picture, the medial malleolus is the prominent bony projection on the inner side of the ankle. It is the distal end of the tibia. When you see the lateral malleolus, the fibula forms the lateral malleolus. Question number 17. The olignanon process is a prominent anatomical landmark found in which bone? A. Radius. B. Ulna. C. Humerus. D. Scapula. Pause the video and think the answer. The correct answer is B, ulna. You can see in the ulna bone, the olecranon process here. The olecranon process is the bony projection at the end of the ulna that forms the point of elbow. It articulates with the humerus. Question number 18. The acetabulum is the socket that articulates with the head of the femur. It is formed by the fusion of which three pelvic bones? So there are four answers. Please pause the video and find the answer. The correct answer is C. Ilium, ischium, pubis. You can see the acetabulum is formed by the bones ilium, ischium, and pubis. You can see the acetabulum is situated here. Question number 19. The carpal bones are located in which part of the body? A. Ankle, B. Wrist, C. Foot, D. Fingers. The correct answer is B. Wrist. You can see the phalanges form the digits or fingers. Metacarpal form the palm or the hand. The carpal bones form the wrist. Question number 20. Which of the following is not part of the vertebral column? A. Cervical vertebrae, B. Thoracic vertebrae, C. Lumbar vertebrae, D. Scapular vertebrae. So it's a straightforward question. D. Scapular vertebrae. Question number 21. The patella is commonly known as the A. Shin bone, B. Thigh bone, C. Kneecap, D. Ankle bone. The correct answer is C. Kneecap. When you look at the anatomy of the knee joint, you can see patella is here. It acts as a kneecap. Patella is a sesamoid bone located within the quadriceps tendon, commonly known as the kneecap. Question number 22. The medial and lateral condyles are anatomical features primarily found on the distal end of which bone? A. Femur, B. Tibia, C. Humerus. The correct answer is A. Femur. So when you see the femur, you can see there are medial femoral epicondyle and the lateral femoral epicondyle. The distal end of the femur has the prominent medial and lateral condyles that articulate with the tibia to form the knee joint. Question number 23. What is the anatomical name for the collarbone? A. Scapula, B. Sternum, C. Clavicle, D. Humerus. The correct answer is C. You can see the clavicle here. This is called the collarbone. The clavicle is the scientific name for the collarbone, which connects the sternum to the scapula. Question number 24. Which of the following bones form the posterior and inferior part of the cranium and contains the foramen magnum? A. Frontal bone, B. Parietal bone, C. Occipital bone, D. Temporal bone. Pause the video and think the answer. The correct answer is C. Occipital bone. When you take the cross section of the skull bone, you can see this is the posterior and the occipital part. So you can see this is the occipital bone, the broad colored one, and it has the foramen magnum. The occipital bone located in the back and the base of the skull, it features the foramen magnum. It's a large opening through which the brainstem connects to the spinal cord. Question number 25. Which facial bone forms the upper jaw and contains the upper teeth? A. Mandible, B. Zygoma, C. Maxilla, D. Vomer. So please pause the video and think the answer. So the correct answer is C. Maxilla. On the upper jaw or the upper teeth are contained in the maxillary bones and lower teeth are contained in the mandible. So if we take the maxilla or maxillary bones, is there are two fused bones, forms the upper jaw, the anterior part of the hard palate and the parts of the orbits and nasal cavity. It also houses the upper teeth. The mandible is the lower jaw. It houses the lower teeth. So these are the frequently asked questions on the skeletal system. My channel offers guidance for the medical coding, especially to help you to prepare for the AAPC CPC examination. If you have any issues, please feel free to ask me. You can leave your questions in the comment sections, or you can email or WhatsApp me using the details displayed here. If you feel this channel is useful, please subscribe my channel and stay with me. Thank you.